Dr. Zachary, do you ever treat previous failed foot and ankle surgeries?
We do. Am I getting run recently? A lot more than I used to, because what happens is it's just a, hey, you fixed my friend Betty who was having a problem with one of her surgeries. So for me, we're seeing a lot more of that now, and basically our ability to restore their normal function after something that was less than satisfactory is very, very good.
And what is a typical, what does that look like? Is it immediate? Does someone get a surgery and then 6 months down the line say, well, this is starting to act up again? What typically?
I am getting to the point now where I'm seeing people 2 weeks after a surgery from the doctor, and they come in and it's like, is this normal? Is this swelling normal? Is the pinch supposed to be this way? And they're looking for reassurance, because the reality is you really want to have to promote faith, and your patient has to trust you. And if they do, they're not going to go outside the box. They're going to trust that you put everything in place to make sure they're good. And I always say, always be honest. And from my end, revisional stuff too is tricky, because you're the second man in. It's basically, they're aware you're coming in now, and anatomy's different, the tissue quality is different, the incision's different. The way you fix them is more complex, because there's already been stuff that's failed in that area. But I love revisional stuff too. As I get older, you look for things fun to kind of, to get your own little niche in life. I think it's something that we pride ourselves in. And myself, Dr. Baird, Dr. Flores, and Dr. Tackner are all excellent in it. And, I won't be offended if everyone does an awesome job out there. And we don't have to do that all the time, but it is becoming more frequent, because your practice gets, a reputation to be able to fix anything.